Hello, Professor Alpert. It's nice to have you again in Vilnius.
Always a pleasure to be back again. As you know, as I've said earlier, my family emigrated from here 150 years ago, so I feel very much at home coming back. Yes, well, I think if you're telling patients, you have to do this and you have to do that, but you do the opposite yourself, why should the patient even believe what you're saying, right? If you say stop smoking and they see all the cigarette butts on your desk, of course it's ridiculous to think that they're going to stop. So, I think, and the scientific data absolutely supports the idea that a healthy lifestyle increases your likelihood of living a long and healthy life. I mean, there's no guarantee, of course. Tomorrow we could be run over by a bus, right? Bad luck. But in general, if you follow a healthy lifestyle, the chances are going to be much reduced that you will have an early death or be sick. So what are the things of a healthy lifestyle? Of course, not getting too fat. Of course, not smoking, not using alcohol to excess, and also staying active. So I'm a particular believer in exercise. And I think it dates all the way back to our earliest ancestors, maybe a couple of million years ago, where you were going constantly. I can tell you, your and my ancestors here in Lithuania, they were working 8, 10, 12 hours a day. They were probably farming and they had household tasks. You know, life was difficult then. So of course they may have not eaten the healthiest food, but they were burning a lot of calories every day. Now we sit down, we take the car, we're watching television, we're eating, little chips and things. It's a totally more sedentary lifestyle. I think that's important. And all of the clinical studies that have looked at exercise are all positive, that the people who do regular exercise are actually going to have a much lower risk of both heart disease and a number of kinds of cancer. So the joke I always tell my patients is, you only need to exercise on the days that you eat. So then they pause for a second, they say, that means every day? I say, yes, that means every day. Now again, we're not talking about intensive Olympic type training. I'm talking about where you go out and you walk vigorously for an hour, or as you and I are doing, sitting on an exercise bicycle, reading a book or novels or journals for an hour each day, or mixing it up. Some days swimming, some days walking, some days jogging, some days skiing, whatever. But each day, I think an hour of aerobic exercise is important. For example, walking your dog is not good enough. Why? Because the dog stops every 10 feet to pee, right? Or to sniff some other dog. You need sustained, for an hour, and in the very elderly, people over 80, probably 30 to 40 minutes is enough, and of course not as vigorous as when younger. Now, there's been a lot of controversy there, and the diet is not like exercise. The studies are conflicting. But the newest and I think best studies are the ones both from Spain and from France really show that the Mediterranean diet, with lots of fruits and vegetables, reduced amounts of fatty meats, moderate use of alcohol, particularly wine, olive oil, fruits and nuts and whole grain kinds of carbohydrates, really correlate with a reduced risk for a heart attack. So I think the Heart Association in the United States has pushed for a long time on reducing the amount of fat in the diet, but that's been much more controversial. I think more important is not how much fat you eat, but which types, and particularly the monosaturated, things like olive oil and other vegetables. The 3 omega type fats are important. And we have a huge national survey in the United States called the NHANES. I think it's 10,000 people are interviewed extensively every couple of years about everything they do. When they look at diet, the thing that correlates with reduced risk for cancer and heart disease is lots of fruits and vegetables, and nuts. So lots of natural products. And I know here in Lithuania, there's a big emphasis on fresh fruits and vegetables and so forth, as we've been eating here and in the restaurants. I think that's important. But of course, at the same time, you need to reduce the factors that are very risky, like cigarette smoking. You know, there's been a huge campaign in the U.S. over the last decades to get people to stop smoking, and there's a marked decline in smoking, particularly in middle-aged males, and that is correlated with a decline in myocardial infarction, heart attack deaths. And we know genetics are important. There are families riddled with cancer. There are families riddled with heart disease. And in the future, of course, when we do you know and I know what's going to happen. In 10, 15 years, every child will have their DNA done, and they'll tell the parents, look, this child is at risk for diabetes, this child is at risk for this or that, and so here are some recommendations for the way you ought to bring this child up and encourage them to have that lifestyle for their whole life. And I've had diabetic patients, you know, who were juvenile diabetics who did terrific actions in terms of their lifestyle. They were meticulous about maintaining their weight, carefully followed their sugar, exercised regularly, careful of what they ate, and they're still doing very well 25, 30, 40 years later after having juvenile diabetes. So even when you have a disease that puts you at high risk for heart disease, if you do the right things, there's much greater likelihood that you're going to be okay, as opposed to allowing yourself to get fat and eating and drinking badly and smoking. Sure. Well, first of all, it turns out exercise reduces stress. It's one of the forms, you know, and I think that's an individual thing. You know, this stress is, of course, we can't measure it. There's no blood test for stress. And one of my mentors who just retired recently, the fellow who founded our heart center, Gordon Navy, used to say, you know, he said, yesterday I saw two women. One came in crying and sobbing, oh, I just got divorced. And the second one came in laughing and saying, oh, I just got divorced. So of course there's a huge difference in stress factors. And there's some people who are much more prone to anxiety and stress. People like that, I recommend trying whatever will work for them. Try the meditation. You know, there's a lot of, in the U.S., a lot of interest in a variety of awareness meditations and a number of the Asian types of meditation. If that doesn't work for you, then sometimes exercise works. For other people, for example, playing a musical instrument is very relaxing because you have to sort of focus, you know, on the notes and what you're doing. I think it's an individual thing. Each person needs to find what is best for them. For me, you know, I think it's exercise. Also, I find it very relaxing traveling and visiting, you know, and people in other countries and talking and socializing with people. But that's me, you know, and everybody ought to figure out what works best for them. For some people, it's just sitting quietly and reading once a day. But you're absolutely right. We lead a very hectic life in this technologically highly advanced environment. So everybody has to sort of figure out what works for them.
Yeah, exactly.
But cigarette smoking is not a good stress reducer. Well, you know, Rokas, it was, I think, like lots of things, there's a lot of these things are random chance, fortuitous things. I had a wonderful teacher when I was doing my early clinical work, medicine rotation. I had one of the attendings who was responsible for our group for that month was a fellow named Louis Dexter, who was one of the pioneer cardiologists, one of the people who first discovered the wedge pressure and was the Gorlin formula was done in his lab. One of the first people to do a right heart catheterization. He was also a wonderful human being. And I just remember, you know, we made rounds with him a number of days and he treated the students so wonderfully, and I thought to myself, I want to be a doctor like that. So, you know, I mean, I was interested in lots of areas, but it's always an individual who influences you.
Yeah. Of course, it's always very important to have somebody to show an example.
Yeah, exactly. You know, we do, especially in medicine, where so much of our training is an apprenticeship. It's really, you see an individual, you say, this is the kind of doctor I want to be, and often that determines where you're going to go. My sense of that life in Lithuania is good. Yeah. Certainly better than it was under the USSR, right?
Well, it is.
A lot better.